In 2010, in our community, which is Central Ohio, 1/3 of children are overweight or obese. Yeah. That's worrisome because we know that a number of the children who are overweight will become overweight adults further down the road. Also, obesity is linked to a number of serious comorbid conditions like hypertension, high cholesterol, obstructive sleep apnea, type 2 diabetes. And these are really serious conditions, particularly in childhood.
The Kansas City area, when we look at the statistics from the WIC clinics, as well as the statistics from Children's Mercy Hospital, we're finding a prevalence rate of around 28% of our children. And when we focus on children 2 to 5, 28% that they're either overweight or obese. So we're finding our numbers to be a little bit higher than the national rates. So that's concerning.
I think we, at the health department, we started collecting BMI data in schools in 2005. And what we learned that our at-risk rates were about 16 to 17%, and our obese rates for children in the ages from kindergarten to 7th grade was about 17 to 18%. So overall, our obesity rates, childhood obesity rates, are consistent with the national average.
In the Kansas City area, we had a broad range of initiatives and activities that were going on around this area, but we didn't have a consistent messaging campaign. So we really have focused our efforts and energies based upon the guidance that we've gotten from NICHQ and the Healthy Weight Collaborative to identify a message campaign that would resonate in our community in the Kansas City area.
They were able to inform us as to which design they would respond more to. So we feel like we had good community involvement in the whole process.
One of our projects is a community garden. And when the families come and help us plant the garden, they also take home a garden in a bucket. And that's a bucket that has soil in it, and they plant herbs, tomatoes, peppers, all sorts of plants, but it gives them an opportunity to learn how to garden on a small scale. And we've gotten a lot of positive feedback. I had a 13-year-old who said to me, "This is so fun, I've never done this before." Second project that we're really proud of, and we're excited about this because we've just launched it, is the Feeding Your Kids program. And that is a multi-sector, free, nutrition-based email and text program for parents. What we're doing with Feeding Your Kids is sharing it in childcares, in the school, in clinics, as well as in all the community events that we go to.
I think one thing that I think is really cool that happened in our team as we started working with the schools around capturing height, weight, and calculating BMI percentile, and then rolling that into a letter that can go home to the parents for the first time. When we started that discussion and really wanted to go down that pathway, it seemed like a very onerous task. But in the discussions and working with the school, we learned that they have a data system in place that manages all the students' information. It houses their fees, their lunch money, their grades, their attendance, and it also has a section that houses their health information. So we were able to capture that system and utilize it to collect the height and weight data for all the students.
The whole partnership between the school, public health, and the clinic, the medical clinic, was that the children got the letter home, sent home, and then if the child was outside of normal body weight, that they would then follow up with their primary care provider. And so we're continuing to see how that's coming into play. We don't know yet, it's still too early to tell, but it's been a great partnership from the beginning.
Overall, the framework that has been provided by NICHQ and the staff of this collaborative has been very valuable for helping guide our efforts help us ground and focus our efforts and really build some foundation for some long-lasting, sustainable effort. So their counsel of start small, make it work for that small scale, then grow it from there was really very helpful.
The things our team recognized early on is that obesity isn't something you can tackle just in the clinic. We had to move out of the clinic into the community. And for our kids and our families, the community included the schools, the childcare, the churches. And that's really what this Healthy Weight Collaborative allowed us to do. To effectively address childhood obesity, you have to have many partners on the table. And those partners come with expertise, with passion, but they also come with their own agendas and personalities. And one of the most important things is to define your goal early, to keep the team focused on that goal, so that we always remember it's all about the kids, it's all about the family, it's really all about our community.